Hello, this is Scott Jentz. Welcome to Sandbox Stories. Hello, welcome to this Sandbox Story, which is an interview with Dr. Sherrol Reynolds. Dr. Reynolds is full professor at Southeastern University College of Optometry, and she's got a story about becoming an optometrist and an optometric educator that is incredibly inspiring. I'm very grateful to have her as my guest today. Dr. Reynolds, welcome to Sandbox Stories.
Scott, thank you so much for having me today. It's a pleasure to be here to share my story and hopefully to inspire the next generation of future optometrists to become optometrists. So thank you.
I love it. I believe that will be the promise and we will carry through on it. In preparing for this, I came to understand your passion about the value of mentorship. Can you give us a sense of how or from whom you came to realize this about yourself?
So I think it's important to recognize the mentors in our lives, right? So for me, I mentioned in my snippet that my mom was my biggest cheerleader, but I would really categorize her more as my biggest mentor. Just guiding me through my stages from elementary school or the middle school to high school, and then becoming the first in my family, as I mentioned, to graduate or to attend a major university and to graduate. And, sometimes we get a little stuck in our thought process. What do we want to be? What do we want to become? I think if I share my stories with a lot of the students that I mentor, it's always, I wanted to be a pediatrician. That was my thought. But I also, too, Scott, wanted to be a teacher. So I saw myself as a teacher, but I really wanted to be a pediatrician. So I went into University of Florida becoming a pediatrician or thinking I would become a pediatrician. And it didn't really work out the way that I thought. And having my mom as my mentor and guiding me, figuring out the next step. That's something I wanted to do in the healthcare field that would be impactful for patients or for others, just to make a difference. And she was the one that really guided me to the next step. I thought about my aunt who went blind from diabetes, and I wanted to understand the disease a little bit more and why she went blind from this condition in one of her eye. And I talked about it with my mom. And I want to mention, Scott, this was before internet. And so for me, being the first one in my family to go off to university, there's no, we're immigrant family. My family came from Jamaica. And so at that time, really knowing someone in a healthcare field we didn't know, I had no one to kind of say I wanted to be this. So she really guided me in that process. And we started looking into optometry. And it was interesting because a new school opened in Miami, and I'm from Fort Lauderdale, Florida. And so that's my segue. I applied, I took the OATs, and I got in. Along the way, I thought it would be the first minority in optometry school because back then you didn't have the internet, so you didn't know, and then there's all these other schools. But I really just applied only to Southeastern at the time before it merged with Nova, and I got in. And so again, having a mentor, like someone like Dr. Terrence Ingraham, who came on to Nova Southeastern University from Vistacon at the time, and he was such a trailblazer in the field of optometry. I don't know if you know his story or you've ever heard of him, but he was one of the first to graduate from UAB College of Optometry and some of the things that he went through. And he was also, from the Bahamas. So he was an immigrant. He was adopted and given this opportunity. And he was just, I don't know, I just gravitated to him while I was in school, and then he became my other mentor. I mean, one of my most impactful mentors, Scott, because he also introduced me to the National Optometric Association. And at the time, that was important because to see others other successful optometrists like myself, I hadn't before. In my class, there are a few of us, but I hadn't met an optometrist, practicing optometrist, that was a minority, that was an African American minority, Afro Caribbean minority. Just I didn't meet that. And so having and meeting Dr. Ingraham in my life was truly impactful in so many ways. The other thing that he did for me, why I say mentorship is so important, is once I graduated, I did a residency. I opened up a practice in a commercial setting after the residency, and I was there for about 2 to 3 years. I think about 3 years. And you know how, like, when you're in these early start of your career, should I go into private practice? I'm not sure what I should do. I just didn't want to stay at this commercial practice. I thought I had outgrown it a bit, and so I was really looking at that next step for me. And he was the one that really talked to me about being on faculty, the importance of being on faculty. I was one of the first African American faculty at Nova Southeastern University with him. It was the first female, he was male, and he just guided me through that process. And so he has really helped me in so many ways, just the NOA, introducing that organization to me, encouraging me to be on faculty, supporting me, guiding me every step of the way. And, I'm so indebted to him. He did pass away about 2 years after I came on faculty. And I always say, not to get spiritual, but he kind of knew, maybe he paved the way. And that's why he was really adamant about me coming on faculty. I say I stand on the shoulders of giants that have come before us. I stand on his shoulder because he really was such an instrumental person in my life, such a great mentor. And he's the reason why I am at Nova Southeast University to this day. And my passion for the NOA, being past president, continue. And because of that, I even serve as a mentor. I been for the last, I think about 15 years, a high school mentor at one of our local high school here. It's with an organization called Women of Tomorrow. And the goal of Women of Tomorrow is to mentor high school young girls that are at risk. We know studies after studies show that mentoring will help these young ladies succeed, think about careers. So I've been really happy to be that. I've been happy to be a mentor for up and coming NOSA students, up and coming optometrists. I call them my optometry babies after doing this for so long. So mentorship is really, really important to me.
I mean, what an incredible full circle story. I want to go back to your parents. Tell us just a little bit more about your mom and your dad and their days in Jamaica. It just seems like a really important part of your life. What was she, other than a mentor, what was she like as a human? What did she do? What did your dad do?
So again, my story is a most immigrant story, right? A success story. My parents were born in Jamaica, and they weren't born to the best of luxuries. They struggled. They had it hard. They got together. There's 5 children, and my dad came up to the United States as a farm worker, and he worked in South Florida as a farm worker, and he was fortunate to get this green card and to bring the family here. And I always say that really changed the trajectory of our family, and it allowed us to have a little bit more success. In Jamaica, my parents couldn't afford to go to high school because you can go to I think it's first level in secondary school, but going to high school and college, their family could not afford that. So my mom and my dad were really passionate about education, especially my mom. I would say that my mom, if I were to describe her to anyone, unfortunately she passed away my 4th year in optometry school, but she was such a spiritual individual. She was such a giving person. She believed in education. She believed in picking yourself up by the bootstrap, working hard to become the very best you that you can be. She was always giving words of wisdom, encouragement, and guidance. And, without her, I think I wouldn't be who I am today, just as a person, not as an optometrist. So I'm hoping that some of her is reflected in me. My dad, he was just a hard worker. He got up every day. He went to work as a construction worker. It was very hard for him, but he provided for his 5 kids and his wife. We were able to own a home. He supported his children as best as he could. So I always say, because of my dad's tenacity and hard work, is partly where I see being, driven, because he was so driven. And so they worked really, really, really hard to make sure all the kids succeed. My sister is a lawyer, a prosecutor. My other sister works in bank and financing. My brothers work in, Motorola software design. So all of us had that opportunity because of our parents to really succeed. So I would say that they were tenacious, dedicated, committed, spiritual, forgiving, and just wonderful parents. I think everybody thinks their parents are wonderful, but they were wonderful parents.
It's so fun to hear how you and your siblings were motivated and driven and took the embodiment of each of your parents' best qualities forward. I think that's wonderful. I want to talk to you a little bit about the decision to go into optometry. You said your aunt lost some sight from diabetes. Had you ever had eye care? Were you somebody that was normally sighted? What else sort of got you to start thinking about taking the OT exam to apply to optometry school?
So, it's so interesting because, like I said, I was pediatrician. I volunteered at Shands Hospital, and I didn't like it. I was like, these babies. I was so emotional about the young kids and the young kids in the peds department. So, I think it was my fourth year at University of Florida. I started to really kind of reassess. Do I want to go to medical school? What else can I do? I thought about dentistry, and being in the mouth of individuals is not something I see myself doing. I thought about podiatry, and back in those days, as you know, we had to go to the library and do our research on professions. And so, I always wore glasses. I've always gone to, it was fifth grade. I think I got my first pair of glasses. I used to have terrible headaches at the end of the day at school, and my mom brought me to go get glasses. She wore glasses, and it just changed my life. I could see. I
What kind
mean,
of an RX did you have?
my prescription was a -2.
Okay.
So I was a myope with a little bit of cylinder at that time, but it changed my world. When I say see, I could see the chalkboard, I could see my friends, and I could see life. When my students interview or when students interview and say it changed their life, yes, it does. To be able to know that you weren't crazy, that you couldn't see, and now you can see. But I went to ophthalmologists in the beginning. My mom took me to a general ophthalmologist to get her eyes examined. I think it was maybe my eighth grade year. I wanted contact lenses, and went to an optometrist at one of the local. It was a Sears Optical, and she became my optometrist at that time, and we got fit for contact lenses. And I didn't even think about optometry and going to her, but once I kind of sort of narrowed in what I wanted to do, and I knew I wanted to do something in the healthcare field. I'm so passionate about helping others. I thought about my aunt, and that's where the whole connection of diabetes and eyes. And so it was, how did she go blind? Maybe I could have prevented that. And so I thought, if I became an optometrist, see what's going on in the back of the eyes, understand, I could prevent her from losing the other eye, her good eye, and prevent others from losing their vision, not knowing fully at that time what it all entails, right? So that was my goal in applying to optometry school. And like I said, I was fortunate. I really feel I was blessed, and it was timing that this new school happened to open in Miami called Southeastern. And I graduated, I think I was their fourth graduating class. So it was their fourth class to be accepted in. And, again, was it easy, Scott? It wasn't easy at all because, no one tells you, like going off to UF, no one told me what university, no one in my family knew what university is like, these big classes. So I did have some challenges, and that's why it's important for me to mentor and reach out and reach back to students who are coming up, because I still think they face these same challenges, right? And so it's important to let them know my story, and that you can overcome those challenges and you can become that successful optometrist that you dream of being. So that's how I became an optometrist in optometry school. Her condition, my aunt, even propelled me to do a residency. I enjoyed my time at Bascom. Right now I'm in charge of the retina clinic here at Nova Southeastern University. The back of the eyes is really important to me, just because, I I'm part of this NEHAP group, the National Eye Education Health Program, the National Eye Education Health Program, NEHAP, and it's an important group. And one of the things I always say is that your vision, like an eye exam, is more than saving our patient's sight. We can save our patients' lives. And I know that has been said in different ways, but I say that all the time to my students because I think about my aunt and her quality of life and the way she got depressed after she lost her vision. She sort of gave up a little bit, Scott, and wasn't really good at taking her medication because what is it going to do? I'm already so sick. So, there's so much more layers to just being diagnosed with diabetes. The loss of vision is such a big thing. It's what we all know is the number one fear. Most people fear losing their vision than anything else. And that's what happened to my aunt. And unfortunately, she did lose vision in the other eye as well. So,
The other area that I know you have a lot of passion about is diversity in optometry. You've already mentioned the story of Dr. Ingraham and your introduction to the National Optometric Association. Would you please help the audience understand more about what the National Optometric Association does and how your work there has helped transform the profession and bring it forward?
So yes, no, I can definitely because I'm very pleased that I served as president of this organization for about 4 years during the height of a reassessment of where we are in this country when it comes to race relation. And 2020, I was president 2019, 2020. 2018, 2019, 2020, 2021. So the National Optometric Association is an organization that was started in 1969. And in the 60s, the civil rights movement, Scott, unfortunately, is just where America was, and hopefully we don't go back to those periods where, there was discrimination. And so African Americans, minorities could not really participate fully in the AOA. And I know that's a history because a lot of times when I bring it up, people's like, "Well, that's not how it is now." But you could have joined the AOA, but some hotels, especially the ones in the South, it had signs that said "No blacks," no Jews. There was just discrimination. And so there were these 25 awesome, amazing optometrists led by visionary leaders, Dr. C. Clayton Powell and Dr. John Howlett. They both have since passed. But these young men decided at that time to create an organization where minority diversity can have a voice. And so in 1969, this organization was created to give diversity, African Americans, Afro Caribbeans, Hispanic, a voice in the profession. And so since then, we have done a phenomenal job. They did challenge the schools to make sure that they were committed to diversity, inclusion, equity, and belonging before diversity, inclusion, equity, and belonging became a buzzword, right? So in the 60s and 70s and 80s, they really challenged the schools and colleges of optometry to really be committed to that. The NOSA students, the National Optometric Student Association, is a branch of that to really make sure that at each school, and there's a NOSA chapter, that we have diversity, inclusion, and equity and belonging. And because of their leadership and guidance over these more than 50 years, we've tackled and addressed the issue of inclusivity within our profession. Our profession is becoming more diverse. The United States of America is more diverse. And so I just think the profession needs to reflect that, and it is doing a great job. I think our optometric profession is moving forward. We have a long way to go. When you look at the percentage of African Americans in our profession, there's a lot of work. It's roughly maybe 2.83%. Which is really sad and low, but we're doing a good work in making sure that we bring those numbers up. When it comes to our Hispanic Latinx, the same thing. I think it's less than 4% in representation of minority. I mean, our Asian population are well represented in this profession, so that's great. But other underrepresented minorities, our island Pacificers, are underrepresented in our profession. I just think that diversity within any profession is really important. Just in addressing our patients are diverse. So I think that's an important component to have. There's always this discussion: is the disease based on race, or does the patient's race impact their disease? We know studies after studies have shown that the patient's cultural, racial, demographic, factors can influence not just their systemic disease, but also their eye disease. We know that uh, minority patients are disproportionately more impacted from glaucoma, diabetic retinopathy, and other conditions that can potentially rob them of their sight. So diversity is important.
I'm really glad you gave us that summary and your passion's clear. And there's all kinds of additional Sandbox stories I encourage my audience to look at. Dr. Adam Ramsey, Dr. Essence Johnson, Dr. Jacoby Cleaver. You are one of these wonderful messengers of the power of the profession, turning out optometrists that look and serve the public that wants doctors to look like them.
Yes. And, I'm really excited about that group, the Essence and Jacoby and Adam Ramsey. I do, we all need to work together. If you were going to ask me what is my concern for us going future, is making sure that we're working together. And I always say together we're stronger than we are individually. So we all need to work together to make sure. I know that different groups are forming. You have your Latinx group or your Hispanic group. We have our Asian. I understand that we can all go into our silos, but we're not effective in our silos alone. You're effective together. And that's one of the beauty of the National Optometric Association. When Dr. Powell and Dr. Howlett challenges schools to make sure that they had diversity, it was for all diversity. It was for our Asian and our Hispanic and our island Pacificers and our minority patients, our Black patients, so our Black students. So it wasn't just one group. We've been fortunate to have two Hispanic presidents that were president of the NOA and working together. And, we recently had our convention in Philadelphia. And one of the things that I just love is seeing the NOSA chapters at the various schools that encompasses various racial and ethnic groups, and our scholarships that we've given close to $1 million in scholarship, is not just to one demographic, but across the board to different diverse excellent, awesome, amazing students in our schools and colleges of optometry.
Okay, well, now let's talk about your career in optometric education. You spoke a bit about being motivated to do a residency. Was that the beginning of your path to academics? Were you influenced toward becoming an academia a participant by people on your path? I'm really interested in how you made the choice to go there. You talked a little bit about the early practice, but how about ending up becoming on faculty?
So that's interesting because, again, Dr. Terrence Ingraham, my mentor, the importance of mentorship. So in 19, I graduated in 1996, and during my tenure, Dr. Ingraham was, and thank God that he came to Southeastern at the time, but there weren't a lot of diversity in faculty. When you look at the various schools, you didn't see a lot of diverse faculty members. And that has changed a lot, and thankfully. But that was one of my factors as well when he did encourage me to come back on faculty. Like I said, he really, he wouldn't leave me alone. He's like, you're so impactful, you should do it. You're great at this. I interviewed, I did it. And I think it co-aligned with we're all born for a purpose, Scott. And so one of the purpose I mentioned earlier is this teacher part of me. Where did that come from? I didn't even know where that came from. So it kind of co-aligned with that part that wanted to be a teacher and be impactful. And when he passed away, I got here in 2000, and he passed away in 2002, January, from an unexpected illness. It was like I'm stepping into his shoes, and I think he knew it, and that's why he really wanted me to come back. And so I had these shoes, giant shoes to fill, and to stay on as faculty, and to be here, and to represent, and to make a difference as a minority faculty. And I think I've done that. Most of the schools now have quite a bit of diversity. Some don't, some do, but most of them do, actually. And so, like I said, it's important to have that. So being here for the students across the board, is important. Just representing for students of diverse background is important. But also, too, I do have a passion for teaching. I'm in the Retina Society, the ORS, and I think I'm one of the few minorities in that organization. But Retina is important to me. Being able to stand up and lecture in front of an audience and to share perspective and to even talk about the difference in the disease when it comes to race and just social determinants of health, those factors that kind of impact our patients' access to care. I know sometimes we get, especially with glaucoma, you're not taking your drops, so those drops are so expensive for some patients. And how can we help our patients? And more importantly, how can we help that population of patients save their sight? Because when we do, we not only save their sight, we're saving their lives. I mean, I go back to that all the time. So I enjoy teaching. I enjoy learning what's new and the latest, new instrumentation, OCTA, looking at vascular flow. So those things are why I'm passionate about academics.
Now, you had mentioned to me in a pre-interview conversation that you had some other people that were positive influences. Maybe I
So,
should bring them up, Dr. Pisamente, Dr.
yeah.
Coulter. How about that?
So mentors come in all shape and sizes and all different ways. And so, as a woman in this profession, you want to definitely have those women that have succeeded and have done well. Dr. Stacey Coulter is such a giant in the field of pediatric optometry. And, she's been here at Nova. She's been one of my biggest cheerleader, one of my biggest supporter, one of my most amazing mentor. Dr. Pizzamenti, he calls me, I think I'm half pint, quarter pint, or half pint. I can't remember. He's quarter pint. We're both short, but he's just amazing. I have to say, Joe and I go back so far. He was my teacher, and we left the teacher world, and now he's my colleague. But he's also one of my biggest mentors. He's always my biggest cheerleader. Lecturing together, he gives me that opportunity. He believes in me. So I always tell my students that I mentor. Mentors come in all shape and sizes, colors. You just got to allow those individuals that have succeeded an opportunity to help you grow. And I have so many other mentors that, in the NOA, just as a student, going to the NOSA meetings, Dr. Powell, Dr. Um, uh, Dr. Jones, even Dr. Stephanie, Dr. Millicent Knight. Oh my God, I can call her at any moment and just, I so admire what she has done and the impact she has made in our profession, and so many more, so many more. I can call people and they're like, Sherrol. And I'm like, hey, women, men, all these individuals are my mentors.
And a shameless plug, Dr. Knight's another Sandbox story, folks. Dr. Reynolds' story. Listen to hers as well. So you're in a unique position in education to tell the audience about today's generation of optometry students. What could you tell us is different today about the cohorts that are coming in to be taught by you than it was, say, 20 years ago?
So I would say that the students now that we're educating, I love their inventiveness. They're very inventive. They're very social media savvy. When it comes to marketing, when it comes to plugging themselves, believing in themselves, they have a strong sense of self. They have a strong sense of their worth too, Scott. I want to mention that because back in the days, we doctors would be in a position for years. Students aren't taking it. If they're not happy and they graduate and they're not paying, or their pay is not commensurate to what they think they should be paid, they're gone. So I love that about them. They're more tech savvy, so the newest and the latest technologies that are out there to diagnose retina, dry eyes, they're ready and diving into that because they're not afraid. We older doctors were a little bit afraid of new technology. They're not afraid, and that's why I say they're fearless. They are a little bit more needy in the sense that this generation went through a pandemic and social isolation a little bit. So mental health, since COVID-19 is real, so a lot of these individuals need a little bit more reassuring. than before. But I love their fearlessness with that. They may have that they need more reassuring, but they're still fearless. In how they approach their education and their lives. I mean, we're coming up with new ways, Scott, to educate these students. Long gone are the days where you wrote on the chalkboard or the whiteboard. Now we have to come up with different ways, videos, and different inventive ways to teach them. Simulation labs, and they're ready for that. So I would tell my colleagues that these students are more tech savvy, as you know already. These students are fearless. They're willing to dive in and do it. And I love their spirit of their self worth and self value. They're not taking that low pay. They'll leave a job in a minute to
You
the
know,
next.
I have a friend who was another story, Dr. Alan Glazier, who says that optometrists sometimes suffer from some low self-esteem. And I think it's this next generation of optometry that is going to change that because
Yeah,
of that sense of self-worth. I think that's a really important attribute that needs to be brought to the profession.
I agree with you 100%. I think as a woman in this field, sometimes we're a little bit on a lower pay, but we don't know the bargaining chips. We don't know how to really go in there and negotiate a good contract for ourselves. Not this generation. They will go in there and negotiate a little bit better than we did. Again, their practices are going to, they're dedicated to it. Just your platform nowadays, TikTok and social media, to really promote themselves. They're really good at that, and patients see that. And so, they want to find a doctor that's a dry eye specialist. They're not going through the phone book anymore. Their patients are scrolling online looking for this doctor that's really good with dry eyes, or someone who's good with glaucoma or cataracts. So, these students that are coming out are that. They are empathetic. They do care about their patients, I will say. It's just for us as educators to reach them and really educate them. We have to be a little bit more inventive. What we did in the past is not PowerPoint, works to an extent. We have to be a little bit more creative in how we teach these students going forward.
Well, let's go to that. I think that, again, doctors trained more than 20 years ago that are practicing today really don't have a great sense of what's going on in today's optometric education. You've talked about inventiveness. There must be a strong dependence on technology and teaching people with different ways. It's not just, to your point, overhead projectors anymore. What else is going on? Or tell us a little bit how you practically come up with unique ways to teach retina, because it must be something that you work very hard at to do in a multimedia way.
So I think more videos, that them creating more videos, and explaining the condition, more animation. Like I said, the simulation lab is really good. If you've seen a simulation lab, you can go, like you have a simulator slit lab, and it's like a patient is there, but the patient isn't there. And so these students can go into the simulation lab, and they're practicing better. It's like they're in like a 3D world. And you heard about this visual field device and VT therapy in this sort of 3D artificial world, but you're immersed in there. My daughter is an undergrad. I have a 22-year-old daughter, and her anatomy lab was like that. She's like, "Mommy, we were in the brain. We were going through the brain." So the way that they're learning now is so much more inventive. And um, so, for example, when we talk about OCT and what OCT has done for me with retina, when we were in school, it's just drusen. It was just the retina. It's drusen. Now you can understand the layers of the retina. You can really look and dissect the layers. And if you were to do the 3D map on the OCT, kind of gives you the sense of where things are. It's not just superficial and deep. You can really dive into that thin, very thin layer of the retina than ever before for them to understand disease pathology. When we look at OCTA, our ability as optometrists, Scott, to look at the vasculature, no, we can do fluorescein and ICGA, but now you have OCTA. You can see choroidal neovascular changes. While you're diagnosing the patient, to refer those patients out sooner, as opposed to, maybe the clinical sign of edema in the macular area, or the change in the vision and metamorphopsia on EMSA grid. Those would be signs, of course, that are symptoms and findings that say this patient has a choroidal neovascular membrane. Now we could see the choroidal neovascular membrane with OCTA from his retina. EDI, enhanced depth imaging, allows us to look deeper into the choroid. So now we understand central serous is not central serous like how you and I were taught. It's part of a pachychoroid disease spectrum. So the ever evolving, the ever changing landscape of diagnostic technology, wide field imaging. Did we have those in school? No. To get a picture of the entire or 200 degrees out with wide field imaging is so critically important because we can, educate our patients about the changes in the peripheral retina. Our students can see it better. Our patients see it better. If they see the tear or hole, they're definitely going to go to the retinal specialist. So I love those technologies. Now, with any technology, all the good, Scott, AI is coming. It's here. Actually, I'll say it's here. And so we have to be careful with that. Our students can write their papers with AI. So we have to, kind of look at that. For me, I work with the American Diabetes Association. I've been very fortunate to be a consultant. And, the American Diabetes Association recommends screening for patients that have diabetes, whether it's telescreening or AI technology. And there's all these different AI technologies coming out. Is that going to replace us? Like we got to think about things like that. So we know AI technology can diagnose glaucoma earlier based on looking at the data better than we do as a ophthalmologist or optometrist. But maybe incorporating the AI into new software is coming. Spectralis and Zeiss, they're doing that. So maybe the next evolution or next, segment of the new OCT, the new OCT will have AI technology. So, but yeah, when you're teaching them, they're really inventive. They want to learn it a different way. So it's not like, here's the retina and you have this. They really truly have to understand it. And that's what the simulation
I,
lab.
I keep thinking about your daughter in an anatomy class in college, and can you imagine taking a circular ride on the Circle of Willis, right? And
What?
I mean, it's just fascinating, and it's everyone learns in slightly different ways. I just think that's fantastic. Now, you brushed onto some of the threats. I like to ask my guests about threats. I know you feel like AI, we're all wondering how that's going to go. There's large data models being applied to these images. Certainly, retinal images are an easy way to look at it. Glaucoma is another. But you also mentioned the concern you have about making sure we address social determinants of health. Can you help the group here understand why that's so important?
Yeah, so thank you for that. I think that's really important. So, again, the American Diabetes Association and various organizations have recognized that certain population of our patients and are impacted in getting quality care due to the social determinants of health. When you look at Healthy Eyes, Healthy People 2030, when you look at every other group, we've identified that. And I think that really has come a little bit more to the foray or the forefront due to the pandemic of 2020, right? COVID-19 pandemic, certain population of patients didn't do as well as others, right? So we know that disproportionately minority patients were more impacted from that. And also to, again, the pandemic of 2020, George Floyd, kind of, again, opened up that sore of racial inequality or inequity. So there's healthcare inequity, and we know that there's racial healthcare inequity. So addressing those social determinants of health, those barriers are really important. What are some of the barriers? The barriers could be education of our patients, understanding their disease. And, one of the things I always tell my students, I have patients that come to this clinic. I serve a very multi-ethnic clinic in South Florida, a very diverse clinic in South Florida. And again, a lot of these patients have challenges just understanding their diabetes. And so they may come in and say, I don't have diabetes, but they're taking medication. So just really understanding the disease. We know access is important. We know that the urban community has at a food desert, they don't have access to quality food. So asking our patients with diabetes to eat healthier may not do or work well because they don't have access to the healthiest of foods. Some of our patients live in rural areas, and so access to a retinal specialist in a timely manner are some of the barriers. Insurance can be a barrier. It's just getting the patient referred to the retinal specialist can also be something that's a little bit of a hurdle to overcome for our patients. We know finances is a barrier. Again, sometimes with insurance, getting them, but some of these patients don't have insurance. They have glaucoma. They don't have insurance. How are we getting them the drops that they need? A lot of times we put these patients on certain medications, generic medications, but we know if you do that, then you have to be a second medication that they're going to be on. Maybe the most efficacious is Rocklatan, but just affording that can be a challenge for some patients. And it's not just glaucoma, it's even the dry eye drops that are new and awesome and amazing, the Demodex drops that are new, awesome, and amazing. If you don't have insurance, it's really hard to access those. The transportation. So again, just being in rural area and getting to, the doctor's office, the retinal specialist office, but being in the urban area, depending on the bus, weather and time, these patients aren't coming out in South Florida if it rains. Up north, same thing. If it snows, these patients might have a bit of a challenge getting transportation to and from the doctor's office. So these are some of the barriers that are part of the social determinants of health that impact quality care and some of the things that we need to overcome. And again, the American Diabetes Association 2024 really recognized those barriers and how we can better address those for our patients so we have a better outcome for our patients that have that disease.
When you talk about access to care as a risk factor or a threat to a patient's wellness, there are folks that have come up with doctorless examination technologies. Is that a threat or an opportunity for optometry?
I think it's a little bit of both, right? So, like I said, the American Diabetes recognized that telescreening and telehealth and artificial intelligence is an important component, but they also recognize that an in person, dilated, comprehensive eye exam is more impactful and more effective. So, what I feel that, Scott, the telescreenings and the AIs and the teleretinal health photos, it's great because you're capturing a group of individuals that don't have access to care, right? Or limited access to care. The next step is what do we do with that information, right? So if we have these readers that read the images and contact the patient may not feel, oh, it's not a real eye exam. So I don't know, I'm not going to go. So it's really important to educate these patients on the importance of a comprehensive, dilated, in-person examination. When it comes to AI technology again, or doctorless exam, what I say to my students about the doctorless exam, because I've seen several patients. So you have this automated system, it's doing everything, and then you capture the eye and the doctor comes on. Like I said, it could be good and bad. It's good that the patient is there in the office. It's great that they're having an exam, and it's good that we've captured the image. But nothing takes the place of the doctor patient communication and relationship. You build that personal relationship with the patient. They're a little bit more trusting. One of the social determinants of health is lack of trust in certain populations of patient based on history, like the Tuskegee experiment, right? And a lot of people were not trusting of the COVID-19 vaccination because of that. People don't understand there's a history why certain demographics aren't as trusting. So having that in person builds trust. It builds the doctor patient relationship. I'm not having a relationship with a machine going 1, 2, and then another doctor coming in on a screen. That's not I don't know. Like, I think new people, the new generation, Scott, they can develop a relationship. I don't know. But for me, that doctor patient relationship is so important.
Well,
And
and there's a three dimensionality to the
Mhm.
providing of eye care that is just factually needed.
Yeah,
And so I get your point. I mean, there are ways to expand access, but there's also this edification we must do so the public understands better that these two end organs that are sticking out of our face are examined periodically by a professional in person. And when you get there, then you build the relationship that develops the trust and furthers it. So I think that's really the, to your point, it's a little of both. And I just don't see a doctor spending his or her entire career doing virtual examinations. And it's
Yeah, I really don't. And even for me as a doctor, I think it's important to have that personal connection. I'm a proponent of if you see the disease, which is the photos or the imaging that we're doing, and I sit with you and I talk to you, you know how many times my patients have cried just to the simple, you have bleeding in the back of your eyes from diabetes. When you have a doctorless exam, you don't get that empathetic connection. You don't really get that caring component that is so necessary and needed in healthcare. I mean, when we go to the hospital, I use the analogy of the hospital, Scott. I say, when you go in a hospital, what do you want, a virtual device to come in and treat you, or you want that doctor to come in and treat? Are we going to go doctorless surgeries? I just feel that yes, we can have the telehealth. Yes, we can have the automated, the AI system. Yes, we can have the doctorless exam, but it's really critically important to develop that personal doctor patient relationship. That is a
yeah.
fundamental part of patient care.
As we wind toward the end of our conversation, I want to talk about your commitment to the welfare of others. You've been committed to medical mission trips for nearly 2 decades. Tell us about why you do those and what it's like.
So, for me here at Nova Southeastern University, I formulate with a colleague from medicine. So, as you know, it's an interdisciplinary program. You have osteopathic, allopathic, PT, dental, and PAs. We have the different healthcare components here. Our profession here, not all, but most. And so, my friend Dr. Paula Anderson Wards, many years ago, we went to school together, really wanted to give back, and giving back is such a passion of mine. Community service, giving back is such an important component of healthcare. And so, one of the areas that she wanted to tackle was international and Jamaica. And so, as a someone who's from Jamaica, our parents are from Jamaica, we know that one of the issues in Jamaica is access to care, just access to quality eye health care. And so, we've led this trip. It's a multidisciplinary trip. Optometry will set up a little area. Dental will be over here, so we hear kids crying because they're afraid of the dentist. Medicine would be over here. PT, nursing, pharmacy would be there as well. So it's like a multi-center clinic, multi-professional clinic, disciplinary clinic within maybe a church. And again, it was just important to give back. Our goal is to just help those patients in preserving their sights. We've taken pre-read glasses that have been donated by the Lions Club in our partnership. And if we can give these patients glasses that can help them improve from young to old, if we can capture the young ones and improve them, maybe they'll succeed in school. Because we know intervening early is important for these individuals to succeed in school. So I've been part of that for 19 years. I didn't go in the last 2 years just because of COVID. We sort of kind of discontinued it, but now it's back. So I'm excited to plan for 2025 to bring my nose to chapter. And then down here too, we do have our SWASH group, and I admire SWASH in different areas that they go in the Caribbean and just around the world to help those improve their sight. It makes you smile when you help someone, and it makes you cry when you diagnose someone who has an apparent pupillary defect and it's indicative of maybe a potential cancer. And you just pray that that person gets care, but you're happy that you caught it. So hopefully they do get care and that they can, they enjoy their lives. So the mission trip has been a passion of mine. It's something to give back, and just even community service. Every year the NOA does a serve where you go. So wherever we are, this past year we were in Philadelphia. We partnered with a local organization, and VSP is one of our supporters. And all of the VSP glasses are via voucher, so the patients get free glasses that needed in underserved community. So again, it goes back to that mantra of mine. We're more than just saving sight; we can save lives. And so if we can just go into those communities that are at need, at risk, and just help those individuals instead of talking about it, be about it. That's when I am.
And finally, what about the people and the things that give you joy in your personal life? You had mentioned your college age child earlier. Tell us about the people and the things that you do that give you joy.
So I have 2 beautiful kids. I have a 23-year-old daughter who she says, "Mommy, you're my best friend." So I'm her best friend. And so I love my beautiful daughter. It's interesting. I was talking to Don Mancuso from ASCO, Optometry Gives Me Life. Sometimes our children don't want that life. So she's going to become a physical therapist, and I'm excited for her. And she's just a beautiful soul and spirit. And my son, he's just turned 21. He's my little best friend. We talk all the time. My husband, Andre, we've been together for about 23 years, just traveling. I like decorating. I wouldn't say I'm an interior decorator, but it gives me a little bit of a joy to decorate, reading books. And, I wouldn't say I'm a hairdresser, Scott, but I love braiding my daughter's hair. So you see all these styles of braids, different artists like, Megan Stallion or some of these other artists. I definitely sit for about 6 hours and braid my daughter's hair, give her a new style, and braid my niece's hair. I could get clients, and maybe I can do that as a second profession. But I enjoy spending time with her, braiding her hair. Not everybody can do that, so that's something I'm passionate about.
I'll bet you the depth of conversations you can have in that period of time doing hair, it can go anywhere.
It can go anywhere, right? We're always watching TV, talking about the craziest things on television. But interestingly, with my daughter, what I love about her a little bit, she's in the healthcare field right now. She's working at a PT practice, and the biggest conversation is about patients and their physical. So she'll say, "Oh, this patient asked me about their eyes, and I was able to answer. They have dry eyes, mommy, because of you. This patient was asking me about their glaucoma, and I was able to answer that it's important for them to use their drops, mommy, because of you." Or this patient is an elderly patient, and they said something about macular degeneration, and I told them they need to go to the specialist. So that's our conversation. So I'm glad at least I talk eyes around her.
Well, Dr. Sherrol Reynolds, your family, NSU College of Optometry, NOA, and the profession are better off because of you. It's been a joy to have you as my guest on Sandbox Stories. Thank you so much.
And thank you so much, Scott, for having me. It has been a true pleasure.
Absolutely. And to the audience, thanks for attending and listening to Dr. Reynolds' fantastic stories. Until my next Sandbox Story, be great at all you do.